So this isn't about just giving advice, is it? Clinical supervision is not just, hello, I have this problem, how do I deal with it?
No, no.
There obviously is a small element of that, but what actually do you see, what do you feel happens, or what does actually happen in a clinical supervision session? What is the dynamic that occurs there?
Well, an example, for example, is when a supervisee was getting caught up with the transference, and he was not. It was a she was not seeing it as a transference. She was taking it personally, where she felt that the patient was criticizing their therapy. They weren't very happy, and then they began to question the supervisee. And to cut the story short, the issue was that the patient had a difficult upbringing. He was kicked out from school. He was kicked out from school, had a very negative objective, had a very negative understanding of authority figures, that some authority figures are there to help you rather than to hinder you. And so the patient was having problems with very much the system that they had problems going through schooling, problems going through their graduate course, and the therapist began to feel that she personally was being criticized and attacked. And when we looked at this, it transpired that she had some experiences of the same. And therefore, she was being very defensive of herself. And by being very defensive of herself, the patient felt more being attacked.
So how would a clinical supervisor work with that?
Well, you begin to pick up what the supervisee is saying from their own history, and then you realize actually there's some similarity here, and this similarity is beginning to get in the way. So you begin to look at it and say, okay, tell me about your schooling. Tell me how you were brought up in school. Tell me about your upbringing. And that way you begin to tease out what belongs to the patient and what belongs to the supervisee.
Do you ever find that supervisees, when you're asking questions like that, do you ever find that they have a resistance to letting you know? Do they see a relevance of it?
Sometimes they do, because their feeling is they're not coming for therapy, they're coming for supervision, but they don't realize that sometimes if you want to look at certain dynamics, you need to know something about your supervisee. You need to know something about their upbringing, their life, not to give them therapy, but to say, look, there is an issue here, and it's clashing with that of the client. How can we resolve this? And the therapist may very well need, the supervisee may very well need to go and have some therapy.